So when you're launching your program, you're going to be collecting data and you're going to be telling a story. I want you to move away from having an overall fall rate. I want you to look at different types of charts and data presentations that can help you tell that story. You can have run charts, you can have control charts, but I want you to annotate them so that they are indeed a storyboard. If you look at this example, this is made-up data, but what you have here over a 2-year period of time is following a fall rate. Indeed, this is an aggregated fall rate. At every one of these points where you see a dot that's there, that's a month, and you have a calculated fall rate. And then you have at the top an upper level limit, upper level confidence limit, and then the bottom dotted lines that you will see are the lower level confidence limits. And in fall rate, you're always trying to get that fall rate down. We don't want it to go up. We're always trying to get that fall rate down. And you're always trying to reduce the amount of variation that's allowed. That's, as you see on the left, there's more a room for peaks and valleys around that fall rate compared to as you move over to the right of the chart. You want to reduce variation. And then you always have a trend line. So, yep, this is an overall fall rate, but does it tell you anything? So let me show you a different type of run chart. This will tell you a very different story. I want your story. So in this chart, what you now see is that in the blue run chart, the blue line, that's your overall fall rate that you just saw, but look at the red line that you have. The red line is your anticipated physiological falls. What are the anticipated physiological falls? Those are falls that are happening because a patient had blood pressure that dropped when they got up and started walking. They had centrally medications on board. They had trouble with gait and balance and they lost their footing and they fell. Those are falls that happen because of risk factors inherent to your patients. Then look at the bottom of the chart. Look at the purple line. Those are patient falls that are because of an unsafe environment. So what you can clearly see here, and then the unanticipated physiological falls are very rare. Unexpected medical events are very rare. But as you look at this chart, you have some precision. What is your top type of fall? The top type of fall, your most frequent type of fall, is anticipated physiological falls. So that tells you have a safe environment. But what it does tell you is that we need to do better working patients up for their fall risk factors and getting the team on board to be able to treat them. Because anticipated physiological falls are falls that happen because of risk factors inherent to our person. And the only way you can treat them is to do a better job of assessment and get your interdisciplinary team on board to reduce those centrally acting medications to treat those gait and balance problems.